Welcome to the Q&R on the thoracic. So we're going to go over all the questions. If your questions aren't answered on this one, they may be answered on our site. So question 1 from Tasha Baribo, 54. How can you fix a flat back with loss of curve in the thoracic spine? The key is, look at the spine it gets its strength from the curves, not from the muscles. The muscles that run down either side of the spine are called postural muscles. They're based on your perception of the environment, but also the sensors of the vertebrae. Now, each vertebrae has got 3 different types of sensors. The intrinsic muscles have what are called muscle spindles, and they have 4 times the amount of muscle spindle receptors than the standard skeletal muscle. You also have joint mechanoreceptors, in the joints. And the ligaments have sensory component. All these sensory components are communicating to that brain to increase or decrease the tone. So for a flat back, that means that there's also a loss of curve in the neck and loss of curve in the lumbar, more than likely an unstable pelvis. So you got to look at the entire structure there, because once you get a curve in the neck, then the kyphosis starts to increase. Once you get a curve in the low back, then the kyphosis has to increase. So look at the cervical and lumbar spines has the keys to restore that normal kyphotic curve. Okay, that's going to be the key. This is why, if you check out our pelvic health video, we talk about using a foam piece or a plastic water bottle about 4 inches in diameter. It's placed at the bottom of the elbows is the bottom of this roll. Now it's placed back there for 20 minutes, and then you take it out for 10 minutes. 20 minutes in, 10 minutes out. So just by restoring that lumbar curve, and it's placed right at the junction of the lumbar in the thoracic area, or the low back in the rib cage area, and it's placed back there. But by restoring that lumbar curve, you actually increase the kyphosis, or the curve in the thoracic area, and that makes a huge difference. So, and also with a flat thoracic, there may be an unstable pelvis, like 90% chance. Okay, so when I say maybe, it more likely is already there. So restoring those curves, look at our cervical health video, that'll also make a difference. But have a corrective chiropractor look at the entire structure, and then restoring the natural curves, your body will develop the normal curves. Because, and this is the key too, when you look at the normal physiology, okay, you've got joints. The joints are called facet joints. They're in the back half of the vertebrae. Now, they're set at a certain angle in a certain area. So they're set at 30 degrees in the cervical spine, 60 degrees in the thoracic, and 90 degrees in the lumbar. So it's designed to have those natural curves. And because these are the joints that maintain the integrity of the curves. Maintaining the integrity of the curves maintains the strength of the spine. So, and you will get that better. Just look at the entire structure, look at restoring the curves, and look at the lumbar as well. Question 2 from Frankens 66. I have a combination of ankylosing spondylitis and Scheuermann's kyphosis disease of the thoracic spine. Inflammation is under control, but the muscles still get wonky. I try to keep moving, but it's exhausting at times. I'm no longer in chiropractic care because the last time it put me down for a month. What can I do? I just assume to keep moving and eat simple as possible to keep inflammation away. I got to tell you, ankylosing spondylitis, and when you're looking at Scheuermann's kyphosis disease, what happens is the body rounds over. The nerves exit the spine from the back half or the posterior aspect. And so if the disc get compressed, then the body is going to adapt in order to take the stress off of the lumbar or off of the nerves. So this is an adaptive physiologic response. And ankylosing spondylitis, they call it an autoimmune disease, but it's really a tissue production problem. Now, inflammation is that you don't want to keep it under control. You got to understand what it is. Inflammation is a healing process of the body. This is why the non-steroidal anti-inflammatories are a chemical way to decrease inflammation. And this is also why the non-steroidal anti-inflammatories limit the building products of the cartilage, which is proteoglycan production. So inflammation is a healing process of the body. So in order to stop the progression of ankylosing spondylitis, you have to create inflammation specifically at the disc. Now, one of the reasons that chiropractic care can cause significant pain and put you down for a month is that there's not a distractive force. That's the key. So when we're adjusting somebody with a tissue production problem of ankylosing spondylitis, look at it like that your metabolism, you're not building you don't have the right materials, raw materials to build the body. Because you've got that automatic nervous system. One part keeps you alive under stress, that's the sympathetics. The other part regenerates tissue. When you're in pain, sympathetics are firing off. That means that you have less stomach acid and you're getting less amino acid production, so you have less building products to produce that. Now, the way that you got to adjust, and you can have your chiropractor contact me. I'm pretty easy to get a hold of. You have to do a distractive force. That's why we have traction tables at every office. So when you distract that joint and you do a pumping action, because the discs have a horrible blood supply, they get their nutrients through movement or through imbibition. And so when you distract that and you distract it multiple times, you're going to start to feel, and this is from a chiropractic perspective, that the muscles relax, okay? They literally, because think of this, every muscle in the body, if you stretch it, it gets tighter, okay? This is different because you're not stretching the muscles, you're hydrating the discs. When you get that fluid in the discs, then the sensors on those vertebrae change and deactivate or decrease the tone of the surrounding structures because they're not tightening up to correct structural deviations. And again, just to make this point really, really clear, if you have a structural deviation, the body is going to do everything it can to get that spine in balance and harmony, or it's going to be spasming out to protect those nerves, because your body, the nervous system, controls and coordinates every function of the body. So your system is going to do everything it can to protect that central nervous system. So once you de-stress out the pressure on that nervous system and change proprioception, how the brain views the body in space, then the vertebrae, you can create a local inflammatory response, not systemic, and then the body can start to regenerate that tissue healthy, because that's what the ankylosing spondylitis is. It's literally the body, because it's unstable segments, it starts to change that matrix into something more stable. And we need to hydrate those discs, restore that brain function, and then you're able to, or that brain communication is called proprioception, and then your body can start to regenerate those systems healthy. The key is to get somebody with ankylosing spondylitis to the chiropractor ASAP, as soon as possible. And then do stress x-rays. And I can't emphasize this enough, where if you have a structural deviation in the thoracic area, bend into that convexity, bend into the concavity, and see the motion there. That will give you some information. We also recommend doing extension and static x-rays of the neck and also lateral bending films of the lumbar. And this is going to give the chiropractor a clue at what's moving and what's not moving. Now, we do a series of adjustments. We typically do 30 adjustments, and then we do second x-rays to document what's going on. Now, generally, we don't do stress x-rays on the second exam unless there's a structural or a tissue production problem like ankylosing spondylitis, because you may see increased motion on the bending films, and that means that you are hydrating the discs, and the discs are changing to a healthier matrix. It sounds a little complicated, but have your chiropractor contact me, and I'll walk them through how to get it, how to get the desired result, not just finding a tender spot, pushing here until you hear a pop, and which works really good a lot of times. But if you're working with a tissue production problem, you really got to pay attention and change the technique just a little bit, and then your body can regenerate. Question 3. From Christian Medina, 8758. Hey, Doc, what can be done for relief from costochondritis? CT scan of my abdomen showed mild dextroscoliosis of the mid-lumbar spine. I dropped a barbell on my chest, bench pressing nearly a decade ago, and gained the ability to crack my chest. No real pain, but recently, after years of prolonged sitting and dealing with sciatica hip pain for the last 7 years, I'm thinking anterior femoral glide syndrome. I'm 28 years old male. Okay, Christian, we got to get you healthy. Okay, so, buddy, that costochondritis. So, what people got to understand, ribs start at the back and they stop here, right about midline. Okay, not the midline where the sternum is, but where the sternum is a bone from the here to the mid thoracic deviation right there. Bones stop there, and it's cartilage from here to here. That junction of the cartilage and rib is called the costo, which is the rib, chondritis, the cartilage. And that is a tough joint. I work on a bunch of people that are MMA fighters or wrestlers or something that have had a chest compression and have an issue there. Okay, super, super common. So let's look at a couple of different things you got going on. One, have a chiropractor do static and stress x-rays of the cervical spine, lumbar spine, and thoracic spine. And I want to get stress x-rays of the lumbar, stress x-rays of the cervical spine. And if there is any structural deviations, stress x-rays of the thoracic area as well. That'll give us a good baseline. Then on that costochondritis or costochondral junction, it can be pushed in or pushed out. And typically, it's going to be the lower ribs, okay, that are going to have part of this issue. Since you dropped it on the front part, it could be up here as well. So have the chiropractor look, because there's ways to adjust that. On the lower end, you can actually go inside or underneath the rib cage and open it up, and you can reset it. Or it may be popped out. You can also distract and push it in. Use heat, moist heat on that junction. Okay, and in an acute stage, you're going to notice a difference in, I'm talking like 30 seconds. So hot, wet cloths. And what that does is that rushes blood to the area. The reason that costochondritis junction is such a challenge is because cartilage has a really poor blood supply. So putting the heat on there increases the metabolism and increases that tissue healing. So you want to increase inflammation at that junction to help regenerate the tissue, but you also got to make sure that tissue's in alignment. Okay, and so you got to make sure that the chiropractor knows how to adjust that and get that corrected. Now, anterior femoral glide syndrome. Oh God, when I hear syndrome, we all got triggers. That's a trigger. Look at this as anytime someone says syndrome, they really don't know what's going on with it. Now, let's look at the pelvis. The pelvis is brilliant. There's no muscle that crosses the back half of it. So the pelvis is stable, but you do have the psoas muscle and the piriformis, which is a hip rotator, that is going to have an increased tone if the pelvis is unstable. And then a lot of doctors, physical therapists, chiropractors, they're going to look at the spasms of those muscles. Psoas, piriformis, hip rotators, okay, flexors are going to also be spasming out to try and stabilize that area. It's not a muscle issue. Why are those muscles firing is going to be the key. So stabilize that pelvis. Look at our pelvic health video. Make sure that when you're sitting with a 4-inch diameter plastic water bottle, or we have a non-compressible foam that we give to our patients. It's going to be placed at the bottom of the elbow, the bottom of the roll, 20 minutes in, 10 minutes out. Now, if you have significant structural deviations, that will be shown on the lateral bending films, or the bending the lumbar to one side, bending to the other side. We're going to see an aberration of motion. And so by restoring the normal curve, that'll de-stress out the pelvis. Then you got to stabilize the pelvis. Now, also, we got to look at the gait, because if the pelvis and lumbar have been an issue for a while, sitting increases the pressure on the disc right at the top of the sacrum, the L5-S1 disc, 5 times normal. For comparison, Golf increases at 8 times normal. So if you're golfing, 8 hours a day in that swing, okay, and your back is sore, okay, that makes sense. The key is golf is good for you because you get that movement, and motion is how discs get their nutrients. Discs have a horrible blood supply. They get their nutrients through imbibition or through motion. The problem is when you're sitting, you're increasing the disc 5 times normal, the pressure, and you're not moving it. But you are flattening out the post or back half of this, the posterior aspect, so it de-stresses out the nerves, so you're unaware that you're doing damage. That's why sitting, use that exercise of that 4-inch diameter plastic water bottle, bottom of the elbows, bottom of the roll, 20 minutes in, 10 minutes out. Also, get a trochanter support to stabilize the pelvis. We've got to get the knees and the feet rehab too. So when you look at the pelvic health video, you're going to see there's going to be a weight placed on the ankles, and you're going to dangle your legs, just dangle, not lift them up, to open up the knee joint. Then there's exercises to stretch your calf muscle, trochanter support to stabilize the pelvis, and then get the chiropractic care to correct the lumbar, also cervical and thoracic areas. Because if there's a loss of curve, just figure your head weighs 12 to 18 pounds. If that baby is deviated 1 or 2 inches to one side, you're going to have an abnormal force loading on everything. And just for an exercise for everyone, sit up nice and straight in a chair, keep your shoulders level, and translate over to one side, and just hang out there for a little bit. Okay, where do you feel it? You're going to feel it maybe in the shoulder, maybe in the neck, maybe in the low back. So you have to look at the abnormal force loading of the entire body in order to find out why the body has this issue. Then the Anterior Femoral Glide Syndrome isn't going to be an issue. Okay, it's there for a reason. And the Costochondritis, it can be corrected, but you got to restore the nerve supply to it. And also, too, bouncing a barbell off your chest is going to affect the cervical spine, the lumbar spine, everything. So it's not just the point of impact. And you will get better. Let me know how you're doing, because I'm really curious about that. We got to get you to a corrective chiropractor ASAP. Question 4. Adela Clayton, 2161. Hi, Doc. Do you know any of the corrective chiropractors in Colorado? Every single chiropractor I've ever spoken to said corrective chiropractic is not a thing. I know, which I know is incorrect, because I had one in Pennsylvania. He brought me back to life in a sense, in correcting my lumbar curve. God bless you. Okay, so 86% of the schools, there's a big conformity in our society to go along. Okay, 86% of the chiropractic schools are no longer teaching corrective techniques. There's a few corrective techniques that are still amazing. Okay, anybody that takes an x-ray, does a series of therapies, and takes another x-ray to document that they're fixing the problem is a corrective chiropractor. Okay, whether they call it or not, they're actually correcting a problem. Anybody that's not using an x-ray, it's not that what corrective chiropractor does is good and what they do is bad. It's kind of like a dentist versus an orthodontist. Both are essential. I mean, a dentist will give you a good cleaning. They'll take care of your teeth. Fantastic. But if you got a real problem, you got to go to the orthodontist. Same thing with corrective chiropractic. I'd recommend everybody get a set of x-rays, static and stress x-rays, and have them go through a series. Now, a lot of corrective chiropractors could be upper cervical, and these guys are brilliant. Nuka is a good source to find a good upper cervical chiropractor who's going to take an x-ray, adjust, take another x-ray, and document that they're fixing the problem. C1 and that's the top bone of the neck, hugely important in correcting everyone. That's why, or every aspect of the body, because it surrounds the brainstem. So that is an excellent technique. The challenge I have with it is sometimes there's structural deviations that adjusting C1, C2 doesn't really correct. It could, it might not. So chiropractic biophysics is a really good one. They're based in Idaho. Gonstead is also good, but you got to get traditional chiropractic biophysics, traditional Gonstead people that are going to use an x-ray. Then they check and scan each person, each adjustment, and then they do post x-rays to document the structural changes. A lot of neurologic-based chiropractors also do that. The key is it's whatever therapy they do that's effective in correcting the body is a corrective technique. I mean, I've got tons of videos on how to adjust and correct the body. So there is. That's why in Colorado, in every state, use our 7 questions. And the questions are really, really basic. Do you take an x-ray? Okay, beautiful. Some people will take an x-ray because they can bill insurance. Do you get listings off the x-rays? That means, are you using those x-rays to guide your care? Do you take a post x-ray to document the structural and neurologic changes? Is your goal to restore normal function, or are you just working on pain? Now, that's pretty important because 90% of the nerves that come off the spine, there's no pain fibers. So, if you're working on pain, you're missing the function. If you get a doctor that's checking the autonomic nervous system that's responsible for resting, digesting, repairing, regeneration, and surviving stress, and they're documenting that you're in an abnormal autonomic function, and then they can rescan your nervous system and they find out that you're in a normal autonomic balance, man, that's high level stuff. Then do they work on post-surgery? Because the majority of people that have had surgery have altered biomechanics above and below the surgery site. And so it's vitally important that that post-surgery patient, I almost said post-surgery victim, the post-surgery patient, I mean, sometimes surgery is needed, is they have no other option than to get to a corrective chiropractor to restore the normal biomechanics above and below the surgery site. And then do they work on seniors and kids? Because a lot of chiropractors aren't familiar with correcting kids. And it's odd to think that kids might need corrective care. Just look at how many kids are born C-section. That's 4 times the amount of pressure on a kid's neck. So getting them checked by a chiropractor that's skilled in that is a good idea. And then a lot of people are taking that there's a big osteoporosis thing going on, which has to do with blood acidity. And we can't really get into the causative factors of that. But when you do have somebody with osteoporotic fractures, you have to get that area into a healthy metabolic response. And again, that's a different skill level. So you get somebody like that, beautiful. And the chiropractors, if they say yes to 5 of the 7 questions, you got a good one. It's rare. When you find one, hug them, tell them I love them, and give them my best. Now, if your question wasn't answered on this, go to the Dr. B VIP. So, and God bless you all. Keep sending in those questions, and we'll get to as many as we can. But now we're going to go. I'm going to go to the Dr. B VIP and answer the questions without the my verbal limits. God bless you all. Stay healthy, my friends.